Hey, Kim Denton, have you recorded a meeting on Zoom and did you record it to your computer or to the cloud?
Becky, I have not recorded a Zoom meeting, but I think I would just do it to my computer. Martina, is that right?
Yes, that's what I do it to the computer, and then it will save it when you end the Zoom, and it'll be a file on your desktop.
Yeah.
Thank you. Lots
Good
of
morning, everybody.
figure out. Let's go ahead and get started because my clock says 9:01, and if people continue to join us, that will be just fine. And I want to welcome all of you and say that it just really heartens and moves me that in the midst of this crazy time, you have taken the time to sign on to yet one more Zoom meeting and chat with us about field. And it's just a sort of a symbol of your commitment to our students and your partnership with the college. And we just want you to know how deeply we appreciate all that you do. I am recording this meeting, and Martina has helped me understand I'm recording it to my computer, just in case there are people who need to see the meeting who were not able to attend. So it is being recorded. We didn't ask people to register for this. It seemed like an extra step, but we would love to know who all is here. So if you would not mind just clicking on the chat button at the base of your screen and just put in the chat your name and your email address. And that way we will have a record of who was here. And also if you're sharing contact information with each other, people can see that. So hopefully you're okay with doing that because we'd love to know who all is here. My name is Becky Jackson, and I'm the Director of Field and International Education for the college. My office is in Knoxville, but I work with our bachelor's program, our master's program. We have field, bachelor's field, campus and online, master's field, Knoxville, Nashville, online, in-state, out-of-state. So we have a lot of field faculty and a lot of students. And so my job is really to support the field faculty who are doing that work. And I'm happy to see that we have some field folks with us. You may know some of them. Kimberly Norris Denton is our field coordinator for the BSSW program on the Knoxville campus. And Martina Ward is the field coordinator for the master's program on the Knoxville campus. And then we have Susan Bryant, I saw somewhere, who's our field education specialist. You may hear from her. She's doing a lot of placement development, helping us place students, doing all kinds of things in connection with agencies. So other people may sign on, but there are a few field people on here with me. We wanted to have this meeting because we were thinking there are lots of questions out there. Everybody has been trying to adapt for the past 5 or 6 months to what is social work practice like in the age of a pandemic. And of course, we may have people from all over the place, but we certainly know that in some areas like Knoxville and Nashville, we're certainly seeing an upsurge, an uptick in virus cases. So the challenge, the journey goes on for everybody trying to figure this out. And for us, what we've been trying to figure out is how do we do field in the age of a pandemic? And we are so thankful that you have agreed to continue this journey with us. We also want you to know that you are our heroes. We are at the university working to try to train the next generation of social workers. You are out there in the field doing the essential work. You are continuing to figure out how do we serve clients? How do we provide continuity? Sometimes at personal risk to family, long hours. We just want you to know you are our heroes, and we appreciate what you're doing for our profession and the clients that we serve, and certainly what you're doing for the college. So let me talk a little bit about how we're thinking about fall. Some of you may know, because some of you were probably involved this summer with students who were in field this summer. During the summer, we only have about 100 students in field. And about half of those are bachelor's juniors, and the other half tend to be students who are starting their master's concentration field placement in the summer. And so we did this summer provide a fully remote placement, which involved an intensive seminar, some simulation experiences in conjunction with the College of Nursing, students working on remote assignments, and trying, if at all possible, to connect every student to an agency and a field instructor. We didn't want to ask very much of field instructors this summer because we do know how hard you're working to try to just maintain your services to clients. But we wanted students, if possible, to start to connect with a field instructor so that they could begin to feel a connection to real practice, begin to develop a relationship, virtually, maybe do some orientation, attend some meetings, So students were, a lot of students were able to connect in some ways with field instructors. It was more challenging for others. But we're getting through the summer and we feel like the students have, progressed in their knowledge and skills. As I'm sure you know, UT's plan is to return to in-person classes in the fall. And we are planning to return to in-person field. But that won't be for everybody. It won't be for everybody for classes, and it won't be for everybody for field. One of the things I really appreciate about UT is that through this crisis that we've been going through, the university has repeatedly stated and demonstrated that it is a priority for the health and well-being of students, faculty, and staff to be protected. And so the university has given latitude, really, for students, faculty, and staff to say, I can come to campus and work or attend classes safely, or I can't do that because, and really we don't ask the because, but we know that the becauses are underlying health issues for students, faculty, and staff, or for their family members. So one of the things that's just a reality is that students are being given a choice about whether or not they go to classes in person this fall or whether they do their classes online. And we're offering that same choice to students in field. We did a survey with our students earlier this summer to ask them, what kind of field placement do you need in the fall? Do you need an in-person placement or do you need a fully remote placement? And there were a lot of students that said, I really need to go to field in person. I feel like that's the best way that I can learn. I don't feel like I have underlying health issues that would be an issue for me. I want to go to field. There were a group of students that also said to us, I need a fully remote placement. And some of those students shared with us, specific health issues that they were dealing with or concerns about their children's health issues or their parents for whom they were caring, And so we didn't ask for that information, but a lot of students shared that. So clearly we have students who are dealing with some pretty high risk situations and have said to us, I need a fully remote placement. I need to do field from home. And then there were a lot of students that just said, I don't really know yet. And those students said the reason they didn't know primarily was, we don't know what's going to happen with the virus. So, and of course, that's that kind of cloud of uncertainty that we're all living in. And you're trying to do practice in that cloud of uncertainty of what's going to happen with the virus. And we're trying to plan for field in the same way. So our field faculty have been meeting all summer, really just trying to develop a number of scenarios for fall field so that every student would have a pathway to succeed. We never thought about this idea that we would have a number of students that could complete field fully remotely, like never setting foot in an agency. That would have never occurred to us a year ago, that could really happen. But one of the things that certainly we've seen is the field, and a lot of you, I know, have moved to telepractice, teletherapy, telehealth, telecase management, all kinds of things. And so there's been a bit of a paradigm shift that the field has had to go through, and it's enabled us to think differently too about how students can do field. So one of the things that we really still think, if at all possible, we want to do is for every student to have a field placement with an organization. We want every student, if possible, to be connected to an organization so they can have that real practice experience of taking what they're learning in the classroom and engaging with an organization. But that field placement might be fully in person. The student comes to field in person every day. Or it might be fully remote. The student might be engaging fully in telepractice, telemeetings, teleprojects, or it might be a hybrid. And I know that a lot of social workers are doing kind of a hybrid way of practicing now, where maybe you go to your agency one day a week, but maybe you work at home other days. And I know a lot of organizations are telling us that they're staggering the number of people that are, you know, some people come on Monday, some people come on Tuesday, some people come back on Wednesday, just to enable the social distancing that we're all trying to do. So that would be kind of a hybrid thing where students might come to the agency on certain days, but also work at home on certain days. So we're looking really at 3 types of agency placements this fall: in-person, remote, or hybrid. We also realize that possibly from the get-go and possibly sometime during the semester, there will be students who will not be able to be connected to agencies. You know, we don't know what will happen between now and the middle of August. And so we realize that there are organizations that may have told us today, yeah, we can take your student and we're working in person, and that might change. Or organizations might, or this might happen in September or October. You know, we don't know exactly what's going to happen. And in the fall, we will actually have about 500 students in field, which is kind of an amazing number. But that again includes our bachelor students, our master's students, campus students, and online students. And so what happens is that we have large concentrations of students in the Knoxville area and the Nashville area. But we have students in Chattanooga and Memphis and Cookeville and Clarksville and small towns all over Tennessee. And we have about 70 students who are out of state. And the virus is behaving differently in different areas. And so we're going to be doing a lot of individual communication with students and agencies about what's happening where the students are. And that's going to be complicated and challenging, but I think that's just where we are. So we realize that even though our goal is every student has an agency placement, that might not happen. And so we are working on what we're calling a College of Social Work-based placement option for bachelor's and master's students. And this option will include several components. We're going to be doing an additional intensive seminar with those students. We're also we're developing right now really a bank of remote projects and assignments that students can do, because we have to enable them to address all of the competencies and to be able to earn enough hours to meet field requirements. We're going to probably be doing some simulations again. And we've done that this summer. We're doing that this week with the College of Nursing. And I know some of your organizations, I know Centerstone's a real leader in simulations, and there are other organizations that are doing that. And so we're going to be working with students doing simulations. And if your organization does simulation experiences as a part of your staff training, and there's any way we can learn from you or work with you to provide that experience for students, we would love to pick your brains and partner with you if there's a way to do that. I also mentioned projects. So one of the things that is that we're trying to do is develop a bank of faculty and agency-led projects. So this would be a situation in which maybe an organization can't take another student. You know, maybe you've taken one student, you can't take another student, but there's a project that would be really helpful to your agency. Maybe that project is developing a staff training program. Maybe that project is developing some kind of a resource guide. Maybe the project is doing some research into best practices in a certain area. Maybe that project is actually to do some outreach, you know, by phone or Zoom to clients. We've had several organizations to respond and talk about projects that they think might be helpful for them. And if we have students that are unable to be in agencies, if they can be connected to an agency through a project, then that checks off 2 really important things. One thing is they can address competencies through that project, but the students also have that deeply meaningful experience of I'm doing real work that really benefits an agency. Because our students want to learn. That's their primary goal for getting a master's, but they want to serve. They want to feel like their field experience was meaningful in that it made some contribution, it made some impact, it helped somebody, it helped an agency. You know, they kind of want it to count. And so when there is a project that your organization has that you don't have the bandwidth to do, but you think, wow, a group of students could do this and they could do it from home, then we would love to talk with you about that. So, you know, please do not hesitate to contact the field coordinator that you're working with or me about any project ideas that you have. One of the things that we do want you to know is that if our students are coming to your agency, we are aware that you are taking on, you know, the risk of bringing in a person who could provide additional exposure to staff or clients. And we're asking our students to take that responsibility very carefully, very seriously, and that they will be required to engage in daily self-screening. And your organizations are probably doing this too, but at UT, before any of us go to campus, any faculty, staff, student goes to campus, we're all required to do temp checks. We're all required to answer self-screening questions about whether we felt ill or whether we've been in contact with anyone. And we're going to really be saying to our students, if there's any question at all, if you feel ill at all, if you have any question at all about whether or not your presence in an agency could pose a risk to someone, we're going to ask those students to stay home and be working remotely. So we're going to ask them to do daily self-screenings. We're going to require them to wear masks when they're in agencies. And the university is providing masks for students. I guess a lot of, you know, everybody's collecting lots of masks now, but UT will provide a mask for every student. They're going to mail them, the college will mail them to all the online students. Unfortunately, the campus students in Knoxville and Nashville will have to come to campus to get their mask. And so some students probably won't do that. But we're able to mail them to the online students. So every student should have access to a mask. And we're going to expect them to wear them and to follow CDC guidelines and socially distance. And one of the things, those of you who've been field instructors before probably remember seeing, and you might have seen it recently, a form that we call the confirmation of field form. And that form is the one where, you know, once you've agreed to take a student, the student is supposed to fill out that form with you and say, this is going to be my schedule. This is going to be, these are the requirements I have to meet, like a background check or a drug screen. They have you sign it. And so we've added an addendum to the confirmation of field form in which we're asking students to talk with you about the safety protocols at your organization, if they will be there in person. Now, if they're going to be fully remote, then that's not relevant. But if they're going to come to your agency, even one day a week, on that confirmation of field addendum, we're asking students to talk to you about that and find out what does your agency require? What are the safety protocols? Because we want to know about those. We want the students to be very clear about those, because in addition to whatever we require, you may have additional requirements, you know, that relate to testing or other kinds of things. And we want students to understand those requirements. We're also asking students on that addendum if they are going to be doing any kind of telepractice, any kind of work with clients, whether that's teletherapy or telecase management or tele-support services or whatever that is. We're asking them what they'll be doing, what platform they will be using to do that, whether they have a space in their home. I mean, one of the challenges for our students is having a private space where they live, where they actually could do this kind of work. Of course, lots of students have roommates. Lots of students have children. And children are out of school a lot of times, you know. And so even though in some ways we all kind of enjoy getting a Zoom meeting broken up by a kid passing through or a cat walking over someone, that's kind of fun. You know, providing services to a client, we want students to be ready for privacy, professional space, and really to think about that. We also want students to find out, how will I be trained to do this, and how will I be monitored and supervised? Because of course, part of what we all recognize is that there are risks. And if a student is at home interacting with a client and something comes up, suicidal ideation or something, that the student may not have somebody they can run down the hall and ask about. They can't say, "Will you hold on please," and run get the supervisor if they're at home. And so we want to know that students, that if they're doing telepractice, that it is being done ethically, professionally, that they're being monitored and supervised for that, and that they're prepared for risks that may arise or emergencies that may come up. So we've asked them to talk with you about that and to ask you those questions, and then they'll put those questions on the confirmation of field form. And again, we want to know about that because we're learning about this too. You are the experts on this. Those of you who are doing this are the experts because you're doing it. We're reading articles and we're attending webinars and we're talking to people, but we're not really doing it. And so we really want to hear from you how you're managing these challenges of getting, students and staff to be able to ethically and safely do telepractice, and how that will be set up. So we wanted to let you know about that. Another thing we want to let you know is that we're still trying to finalize the Master's Generalist Learning Plan for fall. So that's first year Master's. I believe, Kim Denton, correct me if this is wrong, but I believe the Bachelor students who are in agency placement, that their learning plan is really not changing, right? Are they going to have the required assignments on there as they've had in the past?
Correct. It'll be the same if they're in the agency.
Okay, whether they're in person or remote, the bachelor plan is not changing. For the master's first year students, those of you who've had those students before will remember that we've had a number of required assignments for those students. We've also had only 3 competencies in the fall. And we're thinking of removing the required assignments this fall just because we're concerned that they may not work in every setting. They may not work for telepractice. They may not work if a student ends up being placed with the college. So we're thinking of removing those assignments and just providing you a good list of suggested assignments that you and the student could pull from. Those of you who supervise second year concentration year master students are familiar with that because that's how you do it every year anyway. It's always, we give you a learning plan that doesn't have pre-filled assignments, and then you pull from the suggested assignments and you make your own, that fit within your setting. So we're thinking about doing that just to have flexibility. We haven't made a final decision, and if people have input about that, in a minute I'm going to stop talking and we're going to listen to you and see what questions and thoughts you have. But we're trying to figure that out, and we want to be flexible because we want this to work for all kinds of situations, and we also know we might have to pivot. We keep being told our accrediting body has said we need to be ready to pivot quickly. So that's what we're trying to do. If we have to pivot from in-person to remote or whatever, we're trying to figure out how to do that. So the learning plan for first year masters may look different this year. Another thing, and this is again just if you have a first year or generalist master's student, is that we're going to start them in field earlier this year. We have typically not started our first year master's students in field until the beginning of October. So if you've had those students before, you've been one of those students, you remember that you start the semester in August, you do a seminar and classes, and then you start field in October. We're concerned about an October surge or a November surge. And so part of what we want to see is if it's possible for students to go to field in the fall, and we hope it will be, that we get them to field as soon as possible. We don't want them to go to field the very first day of the semester if they're first year masters, because we are going to do a 2-week intensive seminar with them that we're calling a boot camp seminar, just to try to get them ready to start field. So they would start field the second week of September. So that's a change, that if you have a first year master student coming to you, whether in person or remotely, they'll be coming sooner. And then UT is actually canceling all fall breaks, like Labor Day is a class day this year at UT. There's no fall break. So what they want students to do is start the semester on at the regular time and end at Thanksgiving. And part of that is that, as UT is thinking, especially about campus students, they're trying to minimize students traveling and then coming back to campus. And so that's the decision. So that doesn't mean we expect you to have a student in field on Labor Day, because hopefully it is still a holiday for you. But for our students, they really don't have any days off during the fall, so they should have more flexibility to be able to be in field more, and we want to get them there quickly.
I have a question for you.
Sure, go ahead.
I'm sorry, this is LaRonda. So that's just master's, that's not bachelor's level, is that correct? For working no fall break. Well, I understand bachelor's level interns don't have fall break either, but do you expect them to be working the same schedule as well, or just the schedule that you provided for those with bachelor's degrees?
I'm going to let Kim answer that question.
Hi, LaRonda. Thank you for working with our students. They'll have the same schedule, yes.
So I just want to say one more thing, and then I want to open it up to more questions. And also, we want to hear your concerns, your ideas. I just want to say that we have really at UT, one of my great blessings is I get to work with a great field team. And you know our field coordinators, because you've worked with them. They are working really, really hard. And I want you to know that they are dedicated to every student having a pathway to success, but they are also dedicated to providing support for you. So our field coordinators, and we will continue to have our field liaisons this year who also provide a layer of support. Our field liaisons will not be doing in-person visits this fall. All their visits will be by technology, just because we felt it was simplest to plan for that. But you will continue to have access to your field liaison, your field coordinator. I am a resource for you. And we know there will be more questions and concerns and changes that will arise this fall. And so what we want you to know is that we want to be accessible to you. We'll try our best to be very responsive to you. We want to know what supports you need, what resources you may need, what we haven't thought about, that you come up with because you're the experts on how this really goes, with students out in the agency. So we really, really welcome and invite you to contact us frequently, and we'll be trying to check in with you more frequently too, because this is a very strange year for everybody. And a stressful year for everybody, and things keep happening. So please know that while of course we're committed to student success, we're also deeply committed to providing the support and resources that you need, and not asking of you unreasonable things, because again, we know that you are also trying to figure out, how do we do social work practice in a pandemic? And so just want to say that. And now I want to be quiet for a bit and see what questions, thoughts, ideas, concerns you have. You can unmute and raise your hand and wave at us, or you can put questions or thoughts in chat if you want to, but we have a small enough group that I think we can just talk. Catherine?
Yeah, so I just have a quick question about the shortened semester. Will that be, so field will end by Thanksgiving as well? Is that right for them?
It could, but if a student is not finished with field, they can continue beyond Thanksgiving. The semester officially ends, but we've always known that in a lot of organizations, if our students take on client responsibilities or even project responsibilities, you might have a macro student that's writing a grant proposal for you that's due in December. So we know that our students, once you accept them, they have also a professional responsibility to you, to your clients, to your organization. So one of the things that I think is really important is that you talk with students about what you will need from them. We always want students to get some kind of break between fall and spring semester, but this year it's really long. And so I think there will be a lot of students, and I think especially second year master students, concentration year students, will not be able to walk away from field at Thanksgiving and not come back until January, whether they're in person or remote. If they're engaging in client services, they have an ethical responsibility to work with you. So technically the semester ends, and technically if a student has done all their hours, all their assignments, all their competencies, you don't need anything from them. There's no reason they should be there between semesters. You know, they can be cut loose for the full break. But if they have professional responsibilities, then I think I would just talk with them about that early and often so that they understand that.
Okay. The only reason so the hour requirement is remaining the same. Is that correct? Their hour requirement?
Actually, we reduced their hour requirement last year, and it's continued to be reduced. So this is what happened. Our students, so you all know, I'm sure, that we're accredited by the Council on Social Work Education. And so the Council on Social Work Education provides our accreditation standards. And in those standards, they provide the requirement for the minimum number of hours for field. We, and some other schools, have always exceeded that minimum. That minimum is 400 hours for bachelor students and 900 hours for master's students. We've always exceeded it by a good bit. So last spring, we made a decision that at least during the time of the pandemic, we would go with the Council on Social Work Education accreditation requirement. So we did reduce our master's requirement from 1,052 hours to 900 hours. Kim, how much did we reduce the bachelor's requirement?
Down to 400, we decreased to 80 hours. So
it was decreased to 80 hours. So they are doing fewer hours. Now, I will say again, that's the minimum requirement. And for a lot of our students, the minimum requirement is really all they can do with everything they're trying to manage. Because of course, as I said, a lot of our students have kids out of school. A lot of our students have jobs. And so a lot of students really need to try to do the minimum requirement. But there are students who can do more, you know. So I think you talk with them about that. But we did reduce our requirement to the accreditation standard minimum.
The bachelor student will be in field 2 days a week, completing 12 to 13, 14 hours a week, typically around that. One thing just to add to that, if the student completes their hours for fall, they can work during winter break and do some hours that could count towards spring. There's a form that you and the student would fill out if the student wants to do that. Just wanted to add that.
And that's same for masters too, that
Yes.
between semesters, additional time. Francis? Sorry, I was muted. I see Francis waving her hand. You're muted. Did you have a comment or question?
No, if this is Francis, I was not waving my hand.
I'm sorry.
Laurie is.
Hi.
Sorry.
I'm probably the agency that's the farthest away in Columbus, Ohio. And I have a master's level student. He started this semester. And I was just curious, is the university willing to change anything as far as we're a large nursing home company, so we have 7 facilities throughout Central Ohio. And we love to have students. We have a lot of students from Ohio State. I kind of oversee all of that. And I'm wondering, I know we're 5 hours away, but even if like we had a group of students that came every other week and stayed for 3 days, I know our agency would be willing to like put them up in housing. So, the students would still be getting an experience. They would just be, doing maybe 3 days 1 week and then not coming back for 2 more weeks for another 3 days. I know it's a 5-hour drive, but when they're doing it as a group, we're happy to take students, and we love groups of students. And it's something that, being in the long-term care business, we put them in the buildings. I think they'd be getting a great, placement. I just didn't know if that's something that the university would ever consider, because we're an agency that's so much farther away.
Well, we consider sending students to other countries for placement.
Oh, okay.
Yeah. I think that's an amazing idea. I think what we'd like to do is just be in touch with you individually to talk about how that would work. And then we could see if we have some students that could do that. You know, again, some students can pick up and go somewhere for a week or two. Some cannot.
A couple times a month. You know, I think at this point, we're just, with the pandemic, we have to think outside the box with a lot of this stuff. And, you know, I know with nursing students, you know, sometimes they have to travel to the largest hospital if they're in a rural area or whatever. So I think it's something, yeah, I would definitely like to speak with you about, you know, as we are looking for placements for some of these students.
Thank you so much for that idea, and we will definitely be in touch. And also, I'm sure you've been communicating with Sarah Cermak, and I may include her in that conversation as well, because
that would be great.
Students not from Tennessee, but from neighboring states, you know, might be interested in doing that. So thank you so much for that idea.
You're welcome.
Okay, I'm looking to see if anybody else is waving their hand. If anybody else has a question or comment, you can just speak up.
This is, hi, this is Emily Edwards. I had a first year intern spring semester last year, and it was pretty easy to transition her once my school closed. I trusted that she had a good rapport with her clients and could continue telehealth. I'm very nervous about having a first year and starting out with our schools being closed and her doing telehealth without me being able to kind of oversee her or watch her doing that, or her watching me. I know you said that we're experts on that, but I definitely am not an expert on monitoring an intern in that way. What suggestions do you have?
Well, I'll tell you that there is an organization that we're going to be placing students with that happens to be a mental health organization that does some telepractice, teletherapy actually, I think, and maybe case management as well. And their plan is that first they'll orient the student, you know, and orient them to things like how to use the technology and how to engage with clients through Zoom and ethical issues related. So they're going to provide some training. And then they're going to allow the student to sign on to some Zoom sessions as an observer and watch the field instructor work with clients, of course with client permission, but that's their plan and they feel confident some clients will agree. Then they're going to have the student work with a client on Zoom with the field instructor signed in observing. And then also the student is going to record sessions and the field instructor will periodically review those sessions. So they have kind of a plan. You know, when we think about field instruction in person, a lot of times we say a great way to do it is let the student watch first, then let them work with you in the room, then let them take the lead with you in the room, then let them do something independently and come back and report. So I think they're doing that kind of stepwise process with students, but they're just doing it on Zoom. Of course, that takes time. That takes time, but I don't think they're going to do that the whole semester. I mean, I think they're going to put some time in on the front end with letting the student essentially shadow and observe on Zoom and then be observed on Zoom, and then they'll be doing supervision and periodic check-ins after that. So that's what I've heard from another agency, but there may be other people on here who have some other ideas that you can share. Does anybody else have other ideas about how to do this training and monitoring of students doing telepractice?
This is Kate LaGrange from Cherokee. We actually had a cohort of psychology interns that just started in July. And the way that we've been training them is much like what Becky said on the Zoom platform, but we've also been able to conference them in on three-way calls. So just like you would have ask a client if it's okay for a student to observe them, we're getting that permission on the front end and then conferencing in that student so they can observe us doing, you know, an intake assessment or a therapy session by phone, and then we're able to observe them doing the same. And that's actually worked a lot better than I thought it would. And clients seem to be pretty open to letting somebody do that.
Thank you for that, Kate. That's really helpful. Anybody else have ideas or experiences with this to share with Emily?
Emily, I'll just say we're planning on doing this. So I work at Belmont University, and so we're in a very similar situation to UT with students supposedly coming back in like a few weeks, but we're fully expecting to do all services virtually, except for maybe crisis. And so we're doing something very similar where we're planning on letting the client decide, you know, obviously getting permission and then saying, would you like their video to be on or off? We're going to give the client that option as well. And then we're going to do the same thing, let them shadow us, and then we're going to shadow them in the Zoom room. Again, letting the client decide if they want to see the second person's face or not, giving them some control in that. So we're going to do the same exact system. The question I have, and some of the same concern, the follow-up question would be, it sounds like you all are okay with students doing, giving virtual services as long as the agency is okay with that. Is that right? Because I have some same concerns about them being in their home where I have no idea where they are. I mean, it just makes me a little concerned too, Emily. So, but I just want to confirm with UT that as long as they're following our protocols, you all do not have any specific policies or requirements for us if they, you know, are seeing people in person or virtually. Is that right?
Yeah, we really want them to just follow the agency protocol. And as I said, we never imagined that we would be planning for a student to do a placement fully from home. But especially for our students who have underlying health issues or family members who do, it's really the only way they can do it. And other than that, we hold them back and prevent them from graduating. And part of what we're seeing is that even though right now we're all struggling to figure out how to function within a pandemic, what I'm hearing from people is that a lot of this will stay after, hopefully someday, coronavirus lets go of us, that organizations have determined that providing a number of services through telepractice will continue because they have found a lot of clients like it, show up for it more, that it is accessible to a lot of clients who may have had difficulty. And people like you are getting the expertise of how to do it and how to do it well. And so I think that it provides a training opportunity for our students also to learn what practice might really look like after they graduate. This might be the kind of job they get, you know. So, and remember that the students will have a learning plan, and they will, if they're doing telepractice with clients, whatever that looks like, they will be addressing some of their competencies through doing that. They'll be engaging with clients. They'll hopefully be assessing clients. They'll be intervening with clients. They'll hopefully have some way to evaluate the effectiveness of what they're doing. But because they're social work students, they'll also have policy competencies and advocacy competencies. So there are certain kinds of assignments and activities that they'll need to do that won't be part of the telepractice. There'll be something else that's on their learning plan that they'll be working on from home. And that might be research, but it might also be contacting legislators or attending action group meetings virtually and engaging. You know, they'll be doing other things. And so they have to do those things, and they have to provide evidence that they did them. And we are going to have to make some assumptions that social work students are honorable, you know, as we always do. But yeah, we never thought we would think about field like this, and here we are. So.
Just one other follow-up question then. What about malpractice insurance for students? Does it cover them for telehealth?
So we have actually a very specific answer to that. And I want to, if you'll give me a second, take a breath. I want to go to my, one of my many folders. Okay, so I contacted UT Risk Management and said, does the professional liability insurance that students have cover telehealth activities as a part of their field placements or internships? And the UT Risk Management person who handles our insurance said, it is covered as long as you are using a HIPAA-approved program for the service and you are following the same supervisory protocols as before between students and professors. So as long as the platform that the student is using is, you know, a HIPAA compliant platform, and as long as the student is getting the same kind of supervision, we would all, you know, weekly supervision of 1 hour from their field instructor, then the liability insurance that students have through UT covers it. Now, one of the things that I wonder about sometimes is if HIPAA is even relevant to certain settings, because of course HIPAA is healthcare. And if a student is in a school setting, I would think it's really FERPA, not HIPAA. So I guess what I would say is that whatever setting you're in, if you are covered by HIPAA, then it needs to be HIPAA compliant. If you're covered by FERPA, it should be FERPA compliant, whatever that looks like.
Well, really, in a school setting, it's state law compliant. So, because FERPA doesn't apply, and I don't know for secondary schools, but for higher ed, FERPA doesn't apply to clinical records. So it's, and I will say we are using, the way we've gotten around that for our malpractice is we're just making sure that the platforms we use are still HIPAA compliant, because we feel like that's kind of a standard. So, yeah.
Yeah, it is kind of the gold standard, isn't it? So if you're HIPAA compliant, you're going to be compliant with whatever else there is. These are really great questions, and this is really wonderful information that you're sharing with each other and with us. So we really appreciate it. What other questions or thoughts or ideas does anyone have?
Rebecca.
Yes.
You know, I was just thinking with everything that we're talking about, like today, my student's working from home because I actually had an exposure in a building. So I'm at home for the next 14 days because one of our staff members tested positive. But, you know, like even last semester when all of this kind of started, I had to think outside the box as far as being a social worker with the students, because I think I had 8 last semester from Ohio State, and I had, you know, it's not just about what social workers do every day, but I had them doing some different things. Like I wanted them to feel involved even though they couldn't go into the building towards the end of the semester. You know, one day we just decorated the outside of the building so that the staff members, the essential workers going in, they stood outside the building, a couple of them, and even cried. You know, the nurses that were going in, and the students had decorated the buildings, you know, the windows and the sidewalks. One day, you know, we delivered PPE to the buildings that were in, you know, a dire need of it at that point. So I've had to think outside the box as far as being a social worker and figuring out, you know, everyday social workers do tasks that, you know, sometimes they're, you know, secretarial tasks or whatever, but I've had to incorporate, I've wanted the students to be involved as much as they possibly can, even though they're not in the buildings. And the student that I have this summer's, you know, not able to go into a building yet, but they have gotten to know the staff, the social workers. It's been amazing by just my trying to find different things for them where they feel valued and they feel important and they feel like, you know what, I'm contributing even though I don't happen to be standing right there at that very moment, you know, in the social worker's office. So it's been really, for me, it's been amazing too to see how the students have grown doing the different things that, you know, I've tried to pull them in and get them involved in.
That is absolutely amazing and wonderful. You know, a lot of times we have the experience that students think, if I'm not working face-to-face with a client, and some students think if I'm not doing therapy, I'm not doing social work. But you know, sometimes social work is taking out the trash or decorating the building or, you know, doing all kinds of things that support the servant, the client, support the well-being of the staff, you know. And if our students can learn that about social work, in social work, I mean, we're kind of prepared for this better than a lot of professions because we know that we might do anything. We're going to do what's needed. And we're not going to feel like we're too good to do what's needed. We're going to do what's needed to support the well-being of the clients, the staff, the community. So I think modeling that as a professional social worker, engaging students in that is just absolutely outstanding. Thank you so much for sharing that.
You know, I even had a student who, she was a seamstress and she made masks for us. And I thought, and they were beautiful, you know what I mean? She did put so much time and effort into them, but I thought how amazing for her. Like she just felt like she was giving so much. And, you know, like I said, it's just thinking outside the box, I think a little bit right now, so.
And you know, one of the things that we say to our students, like we'll have students that'll come into our program and they're musicians or they're artists or they're photographers or they're writers or they're seamstresses or they're, you know, they do woodworking, they do all kinds of things. And one of the things I usually say to students is you can find a way to use that in social work.
Yeah.
You know, there's going to be a way to use music or sewing or drawing or whatever in social work, because these are ways we connect as human beings and serve each other. I think that is just really great. I appreciate that so much.
This is Kate again. I was just going to suggest too that I think it's important when the new group of students starts that we kind of keep in mind how isolating our work can be now that we're working remotely. So I'm on month 4 of mostly working from home. The people that are working in the office are in the office by themselves with their doors closed. We can't eat lunch together. All of our treatment team meetings are on Zoom. So I think kind of preparing students for that kind of work, but also finding as many opportunities as we can for them to join meetings and discussions and trainings, either with other cohorts in their group or with other colleagues, that really helps people still feel like they're connected and they're not just sitting in a room all day using, you know, virtual platforms, making calls. Because it gets tiresome and noticing a lot of colleagues burning out on it. So I think we have to really kind of support our students and find ways for them to engage with other people.
Thank you, Kate. That is really a great reminder to all of us, because that is so important. You know, we start talking with students early in their field experience about self-care, and at first a lot of them don't even understand why we're talking about it or what that means. And this year we're talking about how do you care for yourself in a pandemic physically, but also how do you care for yourself emotionally, psychologically, with all of this isolation and uncertainty. And some students, you know, as I said, are at home and they're trying to figure out how to manage kids. So they have kids crawling all over them, but they're not engaging with adults or people they're not engaging professionally. And one of the things students have always appreciated is just becoming part of an agency. Going to the agency and feeling like they belong and they have relationships with the social workers and the secretaries and the people who clean the building and the people who are the administrators, and just feeling like I belong to this kind of family, you know, because agencies are kind of like a family, and it's hard for them to get that in this time period. And so I really appreciate that, Kate. We all need to attend to that. Other ideas, thoughts, concerns? Something else you might need from us, you know, something we haven't thought about, some resource you might need. We're trying to think of everything, but we know we're missing things, you know, so we need to hear from you about that. And Martina or Kim, if there's anything you want to add, something important I was supposed to say that I didn't say, or please weigh in.
I think you covered everything really well, Becky. I'm just really excited to hear people thinking outside the box and thinking of ways that students can be engaged. And I love that there are different modes in which students will be completing fields. So just want to echo Becky's sentiments about special projects and other ways that students can help your agency, whether that's in person or remotely, because we know that students will benefit from having a connection with an agency. So I think that that's really cool that agencies are finding ways to work with students, and that we're encouraging agencies to think outside the box and find new ways to get students involved in your agencies.
Any other questions, concerns, thoughts? If you have not put your name and your email address in the chat, we would appreciate your doing that, just because we didn't have people register. I know some people might have joined us after I said this, but we didn't have people register for this meeting, so we don't have like a list of registrants. So we would love to have your name and email address in the chat so we'll know who all was here.
I have just a really quick question. By what date should we receive what our student has chosen to do, whether it be virtual or in person? is it just the date that field starts that I should be waiting to hear from her, or is there a sooner time?
We would really like for the student to be talking with you about that now. So okay. I don't know what program is your student in?
I know she's in the bachelor's program.
Oh, okay. So maybe Kim can remind students in the bachelor's program that if they haven't had those conversations with their field instructors about what they need, I would assume that if you haven't heard from the student is expecting in person. I think if the student was really needing a remote placement, the student would have already said to you, I really need to work at home. Can you provide that? So I think if you haven't heard from the student, they're planning to show up on whatever the first day is that they're to come to your agency. But maybe Kim can remind those students to be sure they're in contact with their field instructors.
Yeah.
Okay.
Star, yeah, I would do that. And I'm sending the students a form, that addendum form that they need to fill out. So they'll need to reach out and just talk with their field instructor about some things. So it'll be going out today. Thank you.
Okay. I just wanted to make sure I wasn't bothering her. I emailed her and I'm like, maybe it's still break time and I don't want to bother her, but okay, thank you.
Never hesitate to email a student if you need to get information because you are providing so much for their education. So we're not going to worry about bothering them. If you need to know something, you need to tell them something, go ahead and contact them. Because they should be getting ready for fall now.
Thank you.
Thanks.
And I believe we included on our guidance that students should get in touch with their agencies by August 1st if they've secured a placement. So if you haven't heard from your student, you may be hearing from them soon. And then there are some MSSW general students who are still being placed and some concentration students still being placed. And so I imagine they'll be navigating these questions and addressing these issues with field instructors as they move forward with their placements, and those conversations will be happening. And it could happen that circumstances change where a student feels really confident in person now, but then certain circumstances change at the agency or within their own lives, and changes need to happen as we all move forward.
I'm sitting here talking on mute. I was saying I was looking at the chat to see if there were any questions in the chat, but I don't really see anything in the chat. It's 9:57 and I want to respect your time. We told you this would be an hour, so anything else before we sign off? Well, I just want to thank you again so much for taking the time to come, but of course, more than that, thanking you for what you're doing for our profession, our clients, and what you're doing for our students. And if immediately after we log off, you think of something that's a question, then do not hesitate to contact any of us about that. I'm going to put my email address in the chat in case you don't know it. I'm going to put it there right now. So if you want to contact me, I'm a resource for you. But of course, if you have questions or concerns about, oops, I'm not doing that right. I've got to put who this is to. See, I'm still figuring all this out. Send to everyone. Okay, here we go. So contact me as a resource, but of course your field coordinator is the person who really knows your student and has worked with you with your student, and so they're, you know, a great place to start if it's a student. But if it's a question about something the college needs to provide or concern you have about our program, or you can't get in touch with your field coordinator for some reason, or a project idea, or Lori's really amazing idea of hosting students for several days at a time. Anything like that, feel free to contact me directly. I would love to hear from you and talk with you. So if there's nothing else, thank you so much for coming. So good to see you. We appreciate you.
Thank you all so much.
Bye-bye.
Thank you.